Health Secretary Francisco Duque now joins us on the line. Secretary Duque, good evening. Thank you for taking our call.
Hi, good evening, Pia. Thank you in behalf of the DOH and the Interagency Task Force.
Yeah, Secretary Duque, let's begin with this. No, if we were to play it safe, should we go beyond April 30? What does the science say? Shouldn't we go all the way to X number of months instead of, with there's that possibility of lurching between a lockdown and then complacency, back to a lockdown, tapos complacency ulit?
It's difficult, Pia. We need to be able to test many more people to really get a real picture of the COVID situation. And unless we are able to test about 8 to 10,000 a day, it will be difficult to say anything that's premature. So let's take it, one step at a time. Let's be guided by science and evidence. Anyway, we have really very good people who have been doing modeling of the COVID-19 epidemic. So let's wait until all the data are in and the health system's capacity is able to be, capacitated and improve the absorptive capacity of our health system has to be worked on simultaneously
So we will know,
with.
sir.
Sorry.
Yes, sir. Sorry. So we will know, sir, closer to April 30th. In other words.
Yes, exactly.
Okay, sir. Is there a way to tell? Well, like you said, no, we have to wait for the data to come in, and I guess that would be your answer, because my next question is if there is a way to tell if the ECQ has helped in this fight versus against COVID, and also I wanted to ask, should we have gone into an ECQ earlier than the middle of March?
I don't think so, because we were actually governed by the available data that our technical advisory group had used as a basis for their recommendation to the Interagency Task Force.
Okay. Secretary Duque, there was quite a bit of observations about how hospitals, both government and private, were not prepared for this. And we saw this when they were scrambling for PPEs, for masks, for face shields, and other equipment. Were we not prepared?
The whole world isn't prepared for this, Pia, because the global supply chain has been really extremely limited. The planning did not include this particular consideration of the COVID-19. Nobody knew that this was going to happen. So it's not a question of whether we have the resources or the funding to buy and prepare all these PPEs, all these other medical supplies. So it's really it was difficult for everyone. And I think that's evident. If you look at how all countries are scrambling for more tests, kits, for more ventilators, for
everything.
PPEs. Yeah, everything. So now, in fact, the prioritization is such that the countries with much higher cases seem to have a priority in terms of access to test kits, ventilators, PPEs, etc. But we did two major decisions and actions. Number one, when we impose a absolute travel ban on persons and other people coming from China and its special administrative region, the Macau and Hong Kong. That was what gave us 1 month, okay, to be able to prepare for everything that's happening now. And of course, the second decision, bold decision, is really to impose a enhanced community lockdown or quarantine for the entire Luzon. So,
Okay.
Luzon.
All right. Secretary Duque, yes. Secretary, I have a few questions now about the testing. No, the number of tests don't correspond. Hindi siya one test to one person. It's
Person.
sometimes it's two to three tests per person because you do have to test them again, right? Just
Right,
to clarify
exactly.
lang.
Yes,
Okay,
it's about
okay.
on the average
So
mga two
how?
to three. Yeah.
All right. So how many people so far have been tested, and how fast are the results going to come out now? And also, there won't be any more mistakes, although there were very few. No. So what are we looking at in the future?
Well, we have expanded our testing capacity. We now have 9 subnational laboratories that test. And we have the RITM, which still does the most number of tests. And for answer to your question about how many total number of tests conducted, it's about 29,000 more or less. The equivalent of this in terms of persons tested would be about more or less 24,500. It's not enough. I mean,
Okay.
certainly the daily
Yes.
testing load is about 2,000, 2,500. And we need to scale
Mm-hmm.
this up to about 8 to 10,000 per day. And that will now
Mm-hmm.
allow us to have a more robust data to really have a clearer picture of the COVID situation in the Philippines and use that as a
Yeah.
basis for our recommendations beyond April 30.
Secretary, tungkol naman sa mga quarantine facilities. So for these are for the PUIs, PUMs, yung mga mild cases. Only the severe ones will be going to the hospital, hindi po ba? And are we ready? Those quarantine facilities are good and ready and will be up and running very very soon.
Yes, they're the PIs, the huge ones that we have converted into quarantine facilities for positive COVID patients, but manifesting mild symptoms or asymptomatic. That's we're ready with this. In fact, the Rizal Memorial Stadium, the sports complex, I think it's ready tomorrow. And then the PICC and the World Trade
Mm-hmm. Okay.
Center, all combined, will be about 1,500 beds for our positive
Mm-hmm.
COVID patients. And then we have, of course, about 10,500 plus isolation units that have been identified and readied by different regions. And
Mm-hmm.
we have also, in support of that, our barangay health emergency response teams,
Mm-hmm.
about
DHERT.
28,789
Okay.
across the country.
Mm-hmm. Mm-hmm. And the ones who are going to run these facilities, DOH, doctors, and private doctors na volunteers, ganun po ba?
Yes, there is a complementation of doctors from AFP and PNP and the BFP, and then of course the DOH, our healthcare professionals will complement the ones that I have mentioned, and also volunteers. We have begun hiring under the emergency hiring scheme, and we are looking at about 8,000 healthcare professionals, a higher limit of about 8,000 and a lower limit of about 4,000. And then this is on top of our nurse deployment program. We have about 28,000 of them.
Mm-hmm. Secretary, I'm sure you're aware of public reaction to the case, for example, of Senator Coco Pimentel, who violated the isolation rules when he accompanied his wife to a Makati Medical Center. Also, the reaction to the case of former Senator Bongbong Marcos. As the health secretary, sir, how would you look at this and explain this? What happened here?
Well, in the case of Senator Pimentel, he admitted that he did commit breach of protocol. So he has apologized for this. So I hope that that was a lesson learned for everyone as well, that we cannot compromise the safety and health of our frontline workers by going around despite the obvious need to quarantine oneself. So that's it. I mean, we just have to learn from this lesson.
Okay. Well, Secretary Duque, I need to let you go already. I wish we had more time. Pero maraming salamat po,
Thank
Secretary
you.
Francisco Duque of the Department of Health. Thank you, sir.